When I trained in the 80s, there was a protocol for doing what's called selected breech vaginal delivery. And the criteria briefly were the baby was not too small or too big, the baby was in what's called a frank or complete breech presentation, where the butt is actually what's presenting first, not the feet, not 1 foot up, not 1 foot down, but in a certain position, that the head was flexed, that the environment around the baby was safe. And if those criteria were met, that a woman could choose to have a vaginal birth. What's changed is liability, I think, has caused people to believe that if a baby is born by breech, it has lower APGAR scores or has a problem after birth, or even years later, that there's a potential for illegal action in our country. And so what's happened is that breeches have been gradually squeezed towards cesarean section, and the training of doing vaginal breech deliveries has been disappearing from our residency programs. It is still an option. It should certainly be an option. The American College of Obstetrics and Gynecology, which of course I don't always agree with, but on this particular case, they have a statement that says that if the patient desires it, if the practitioner is capable, and if the certain criteria that we discussed are met, that a trial of a breech vaginal birth is a perfectly reasonable option. If the first baby is head first, and they're not very, very premature, there is really no reason to not let the woman attempt to have a vaginal birth. Even if the second baby isn't head first, what's called a total breech extraction after the first baby comes out is quite easy to do. It is not like a breech vaginal birth, so the skill is slightly different. It can be easily taught. Interestingly enough, the timing of this interview, last week there was a story I saw in the Edmonton Journal that the Canadian government has come out with a statement that's saying they are no longer going to automatically recommend cesarean sections for selected breech deliveries, partly because they're trying to lower their costs, and hopefully it's also guided by the fact that they think it's better for women to deliver vaginally if they can.